Hi there, we are the Suboxone team and we're here to answer some key questions about Suboxone. So first, what is Suboxone? Suboxone is a combination of a prescription opioid drug, buprenorphine, and naloxone, but the naloxone is not absorbed in your body because it is only absorbed when injected or sniffed, and Suboxone is taken orally. So what is Suboxone used for? Well, Suboxone is used to treat opioid addiction and opioid withdrawal, also known as dope sickness, from other opioids like hydromorphone, also known as Dilaudid, heroin, also known as smack, and fentanyl, also known as purple. So how does Suboxone work? Well, when you ingest morphine, inject heroin, or take other opioids, they find receptors and attach to them like a magnet. This sends signals to your brain and gives you a rush known as a high. Suboxone is a very strong magnet. If something else is attached to that receptor, it will kick it out and attach to it. Suboxone activates that receptor at a lower capacity than other opioids and won't let anything else into the receptor, like a security guard. This means it binds to the same receptors that opioids do, but doesn't activate the receptor as much. By binding to these receptors, it eliminates symptoms of withdrawal, also known as dope sickness, like nausea, vomiting, shaking, abdominal pain, depression, and relieves cravings. Are there any side effects? Well, Suboxone can have side effects like any other opioid. Some side effects that are more common include constipation, nausea, headaches, sweating, and abdominal pain. The most unpleasant side effect of Suboxone will happen if you take it right after consuming another opioid. This is called precipitated withdrawal. If you're on a drug like fentanyl, you're activating receptors at 100%, like driving a fast car. By taking Suboxone, it attaches itself to that receptor, causing the fentanyl high to stop all at once, and will cause severe nausea and dope sickness for up to 8 hours. This is why Suboxone can only be initiated if the person is already in withdrawal, or it can be started in very tiny doses, with daily increases in order to avoid precipitated withdrawal. Your prescriber will help you find a dose that works for you in decreasing your cravings and that has the least amount of side effects. It is important to speak with your healthcare provider if you believe you're experiencing any side effects while taking Suboxone. It is also important to continue taking Suboxone unless you speak with a healthcare provider, as stopping can cause withdrawal. So why is my doctor starting me on such a low dose? The main reason we start with a low dose is to deal with any potential precipitated withdrawal. Just like any new medication, there is a right dose for each person, and we want to avoid side effects while finding what works for you. Too little Suboxone and you might still feel the need to use other drugs, but too much may cause overdose and death. Although you can still overdose when using Suboxone, the chances of this happening is much lower when compared to other treatments used for opioid use disorder, like Cadian or methadone. So what happens if I use other drugs while using Suboxone? Since Suboxone occupies receptors, there are less receptors available to other drugs like fentanyl to attach to. Therefore, you can still overdose if you're using other drugs, but the risk will be lower because there are less receptors available. Benzodiazepine drugs like Ativan and Xanax also slows your body down. Using these or alcohol with Suboxone can result in a fatal overdose. Stimulant drugs like cocaine and meth speed your body up, which means your body uses up Suboxone faster and can put you into withdrawal. Talk to your healthcare provider honestly about any drugs, prescribed or not, to make sure your treatment is right for you. So how will Suboxone help me? Suboxone can help you limit, decrease, or even stop the use of opioids altogether. It's all about what you want to do and what works for you. Suboxone, think about it.